Hello and welcome back to The Wrinkle. When is a fall more than just a fall? Let's talk about atypical presentations of disease. So seniors are full of surprises. When you see a senior who is coming in with a certain complaint or syndrome, it may not always be what it seems. Now, falls, somebody is going from standing up to being horizontal, and it's not what they intended. But a fall is not always because of the reasons that you think. Somebody might fall because they have pneumonia, or because there was a change in the medications, or it could be because of a combination of things. In fact, it usually is a combination of things: medications, sensory impairment, environment, and other issues. So I guess what I'm getting at is you can't judge a geriatric senior by their presenting complaint. If you have a tendency to be unsteady on your feet because you've got some arthritis, you've had some wonky toenails that have been very difficult to groom correctly, so your shoes don't really fit and your feet hurt a little bit. You might have some changes in the nerves of your feet, and you're also on some medications that can make you a little bit sedated. Most of the time, though, a person with all of those challenges can stay upright and walk around. But if we throw in a urinary tract infection on top of that, well then the person might fall down. And a senior actually might not come in complaining of the typical symptoms of a urinary tract infection, like having to go pee more often, or noticing a change in the smell of urine, or some pain or burning. The person might just come in with a fall. Same thing with a pneumonia or a heart attack. Name just about any condition and it can present with falling, or confusion, or a change in appetite or behavior. So why is it important to understand that seniors can have atypical presentations of disease? Well, it means that we're going to look for problems that may not be obvious. And it also means that we might not look in places that we shouldn't be looking, that could cause more expense and suffering and hassle for the senior. So if somebody comes in with confusion, oftentimes we would automatically think maybe they've had a stroke, we better do a scan. But perhaps it's more important that we simply check a urinalysis. That only takes a few minutes and doesn't cause any hassle. So if we realize that there are these atypical presentations of disease, we can be much more rational and much more targeted in our assessment of seniors. Not all seniors have atypical presentations of disease. It's more likely to happen in a senior who also has frailty. Frailty is a state of increased vulnerability, and it's usually due to kind of the cumulative effect of a bunch of different challenges, some of which are age-related. So frail seniors are more likely to present atypically. Seniors who are aging very successfully may present more like their younger counterparts. But it's always important to be patient and thorough when assessing a senior. I hope this has been helpful, and if you have any other questions about atypical presentations of disease, the geriatric assessment, acute confusion, I'd be happy to answer them. Leave a comment below, and I'll see you next time on The Wrinkle. Hey, it's Dr. Didyk checking in to see if you want more wrinkle. That didn't sound right. How about if you want more of The Wrinkle? If you enjoyed this video, give it a thumbs up, and if you didn't like it, give it a thumbs down. I want to know what you think. There's a space below to leave comments as well, and you can always hit the little red rectangle to subscribe. That way you'll never miss a video. We upload twice a week on Tuesdays and Saturday mornings. There's lots more Wrinkle over on Facebook as well at The Wrinkle 2. You can see all of our videos there and some other posts, and that's a great place to interact with other viewers. We're on Twitter at The Wrinkle 2, and you can always send me an email at wrinklechat@gmail.com. I try to answer every single comment or question that I get. Thanks so much for joining us here today, and I'll see you again soon on The Wrinkle.